Hey everyone, I'm Dr. Vindhya Pai, and today we are going to talk about facial pigmentation. One of the most common causes that I see is melasma. And as you all know, melasma is a hormonal condition. It can come during pregnancy or after childbirth. It's familial, which means if one family member is affected by this, then you have all the more chances of getting this problem. And also it is triggered by UV light, which means excess of sunlight falling on your face on a long run can actually stimulate melanin to go haywire and produce melasma. So there are different grades. You can have the superficial variety or the deeper variety. The superficial variety responds better to creams, but the deeper variety is a little stubborn and they can leave behind like a shadow on your skin and it doesn't resolve 100%. Nevertheless, as a dermatologist, we educate our patients about the importance of wearing sunscreen because that alone can treat around 60% of your melasma. So wear your sunscreen day in and day out. Choose the right formulation of sunscreen and choose an affordable sunscreen because that is your main form of treatment. You should reapply every few hours, every 3 to 4 hours. Also, you have to apply sunscreens even if you're staying indoors because blue light, infrared light, as well as the sunlight entering your house or your office through the window panes can also trigger your pigmentation. And the other form of treatment is skin brightening creams or skin lightening creams. Now here, as a dermatologist, we give creams containing arbutin, kojic acid, and licorice extract and hydroquinone. But there are some creams called triple combination creams, which, as the name suggests, has a combination of steroid, tretinoin, and hydroquinone. And this is a cream which is like a bleaching cream. It works well for a little amount of time, maybe for about maximum 15 days. After that, you have to stop it because if you do not, then on the long run, it has steroids and it can damage your skin irreversibly, which means your skin can get very thin, the blood vessels underneath your skin can show on the skin, and you also can develop facial hair because of this. So do not use over-the-counter products containing steroids for a long term. It's an absolute no from the dermatologist. So as I said, we finished talking about sunscreens and skin brighteners. Now third thing is exfoliant. A lot of the dermatologists also give exfoliants like glycolic acid or retinoic acid because these exfoliate the upper layers of the skin. So this is also used to lighten the pigmentation. Now the last form is oral capsules in the form of tranexamic acid, which is a wonderful agent for treating this form of pigmentation. It definitely lightens the pigment and really it's one of the mainstays of treatment by me. And I also use a lot of lasers for improving melasma because along with melasma they also have other forms of sun damage, like they'll have skin laxity, they'll have wrinkles, or they will have a lot of other chromias on their skin which can be easily treated with lasers. So they get an entire facial rejuvenation and in the bargain also get their melasma lightened. However, we educate our patients that melasma can never ever go away completely. It lightens by around 80 to 85%, but never by 100%. So you also need maintenance treatments every year, either in the form of oral tablets or in the form of laser therapy, just so that whatever sun damage has accumulated can be reversed. So this is in short how I treat melasma, and so the bottom line here is sunscreens are your mainstay of treatment. Do not use steroid creams for melasma and invest in low intensity lasers to rejuvenate your skin and also in the bargain treat your melasma. Thank you.